Even though we've always been willing to care for children who are seriously or terminally ill, it has been mostly in the last days or weeks of their life. And the reality is that most critically ill children spend a good deal of their time in large hospitals, and sometimes many hours away from their home. Even though we have some services locally, we don't have the full complement of services available. That means that they spend a good deal of their time away from their family, or their family spends time away from other members of their family, from siblings, from friends, and they face difficult situations, often without a good amount of support.
We have incredible families taking care of these beautiful kids with complex issues right next door, and we often don't even realize it. Sort of what these families are doing, and their resilience, and kind of how they're trying to piece together support to make it work. And I think for Four Seasons, we know how hard this is. We know how hard caregiving is, how hard grief is, how hard it is to take care of someone who is sick.
As we're seeing more children facing serious illness, we've done a really good job as a medical community helping children live longer with serious illnesses, that now we have a population that we need to provide care for.
Pediatrics is different because it's kind of like a marathon, and sometimes the end or finish line is not clear. Kids are resilient and kids change all the time. And so you're kind of partnering with not only the child as a patient, but the families as their support person to partner with them on a long distance run. And, coming up with ideas and the treatments and ways to manage symptoms that are different than you would for an adult patient.
So this kid needed support to continue to receive feeding, and had a tube providing feeding into their stomach. And very routine in the hospital, not necessarily a routine thing at home in a very rural area. And so thinking through, how do we make sure we have the right supplies, that the nursing staff have the right training and comfort to be able to troubleshoot and even replace that at home, to be able to, because for this child, if we could save one ER visit, right, for them to have to try to get transportation several hours away to get to the pediatric emergency room to have this tube readjusted or replaced. So that was a significant chunk out of this child's life, and a huge stress on this family. Building pediatric palliative care and hospice programs is expensive. It requires expertise. It requires building a team. But it's important, right? These kids live in our communities. They're our neighbors. This is where we are. We are Western North Carolina, and so this is worth the investment. We need the funding to do this, so that these kids and their families can stay home and be well cared for here.
So some of the things that have been difficult to obtain for children are specific types of equipment. Insurance companies generally cover certain items, but will only pay for certain items every so often. Children can grow quite quickly, and sometimes then their needs change. So if they've had a wheelchair paid for in 1 year, they may not get approved for a new bed or for other types of equipment, or an activity chair or shower chairs, etc. So sometimes it's as simple as getting a $45 shower chair from somewhere. Sometimes it's advocating to get a specialty bed made, a safe sleeping bed that is built on a platform at waist height that might accommodate a portable ventilator unit or a suction unit or a tube feeding pump. So sometimes it's as simple as being able to help provide equipment. Sometimes it's specialized toys or weighted blankets, that kind of thing. Those are the things that insurance tends not to cover. Even diapers that are a larger size are not always covered by medical insurance. If you have a child that has a feeding tube and they have to use liquid, that can get expensive. And so sometimes when they have limited funds, that can be challenging to cover. Other things that are helpful for us are building a legacy for a child, creating memories in their last chapter, things like making handprints, thumbprints to be able to share with family members, paintings, taking pictures, creating those memories within that last chapter. To stand in the gap, to walk with families along the journey, to be able to provide that support has become increasingly important for us as an organization, but also for our community at large.